Hi, my name is Dr. Kumar Vadivel. I'm a board certified periodontist. Today, a patient of mine, actually, he's only like about 20 or 25 years old. He came in with the problem of, hey, doc, my family dentist sent me here to you to look at my gums, and I want to know whether you can help me. So I'm asking him all the questions, hey, how long has it been since you've been to a dentist? And he says, well, the last time I went to a a dentist, it's almost like over 10, 15 years ago. So when I went to my family dentist, he said he cannot help. So he said, you need to go see a gum specialist, and that's why I'm here. So we are looking at his teeth. Whatever you see right here, this is all tartar. And I'm asking him, hey, do you understand what that is? And he says, well, that is the reason I went to my dentist, but I really don't know what that is. What it is tartar that causes the gum disease. That is what it is. And whenever you get plaque when you don't brush or floss your teeth properly, that's exactly what happens. And this is all the yellow stuff that you see. This is all tartar. And let me flip the pictures right here. You see that? Actually, you can look at the back of the teeth. Oh my gosh, it is really bad. You can see how bad the tartar is. This is on the other side. The other side is not as bad as the other side. Look at that. Gosh, there is so much of tartar sitting on his teeth, and he did not even know what that is. So now let me show you his x-ray. This is his x-ray right here. But what I want to show you is I want to compare his x-ray, and there is a lot of damage on his teeth that you will be able to see once I compare it to a normal x-ray. And let me share that with the normal x-ray. See, this is a normal x-ray compared to his gum disease, and you can see all the bone at the bottom. This is on a normal x-ray. Everything looks kind of clean, but here you can see there are so many crowns here, and he has so much of bone loss right there. If you recall, this is where on the back teeth he had all the tartar, and that's where he has all the bone damage. Instead of the bone being like this, you can see the bone is going all the way down. Instead of the bone being like this, then the bone is going all the way down. Now, so what can we do to take care of it? So what he needs to have done is, we recommended he gets all 4 of his wisdom teeth removed, and he needs to get all the broken teeth in the bottom removed, and he needs to have what we call it as a scaling and root planing or a deep cleaning to be done to take care of his teeth. So if you have a problem of a tartar, or if you have a problem of a gum disease, make sure that you're going to take care of that by doing a deep cleaning or removing any bad teeth at your dentist. And if your dentist cannot help, talk to your dentist about being referred to a gum specialist who can help you and to take care of your teeth and your health. And remember, it's not about the teeth anymore. The gum disease can cause many problems, like heart problems and lung problems and kidney problems and even brain problems. So make sure you take care of your health and take care of your teeth, and that will really help you go a long way.